Welcome back. Dr. David DeRose with the Methuselah Factor, 30 Days to Better Health. Today's challenge for day 20 in your 30-day program: depend on your dentist and maximize magnesium. It's shocking to me, as a physician, I have seen too many patients come into my office, and in the context of my exam, I'm looking at their mouth, and I'm seeing cavities, I'm seeing what we call gingivitis, inflammation of the gums. Are you aware that if your gums are not healthy, your circulation is not healthy? That's right. What the research shows is that gum inflammation is a cause of poorer hemorheology. Your Methuselah Factor will suffer if you're not taking care of your oral health. The reality of this is so sobering because if you're trying to avoid heart attack or stroke, if you're just trying to control your diabetes, optimize your blood pressure, all the things we've been talking about that can occur when you get serious about your Methuselah Factor, then poor dental health is right up there with one of the things that can be undermining your best efforts. For this reason, I want to encourage you to depend on your dentist. That's right, I want you to get those regular dental checkups. And although it may not be your favorite place to visit, if you make a regular habit of visiting the dentist, it's far less traumatic than waiting months and years to see the dentist. That's right. It's just like the patient who once came into the emergency room and he was in a coma. Unresponsive. And so we talked with the family. We said, "What's going on?" And they said, "Oh, Grandpa was afraid to come to the hospital because his father died when he came to the hospital. So for the last 2-3 years, he's been bleeding from his rectum, and he was afraid it was cancer, but he didn't want to come to the hospital and die." Well, what do you think happened to him? He waited until he was basically dead. He came to the hospital, and what happened? Sadly, he died. Here's my point. If you're so afraid of the dentist that you're not going to go in there until you're having terrible pain in your mouth and can't stay away any longer, well, of course, the dental visit is not going to be particularly pleasant. But if you depend on your dentist to help you, to be an ally in taking care of your oral health, you are in the right position. Now, here's a sobering statistic. Nearly 50% of adults 30 years of age and older have problems with their gum and oral health. The message is, yes, not only depend on your dentist, but depend on your own oral health care practices. Floss your teeth at least once a day and brush your teeth at least twice daily. Do that combined with regular dental visits, and you are on your road to a better Methuselah Factor. You say, "Well, Dr. DeRose, I'm already doing all this. The dentist says I got perfect dental health. I'm in that better than 50% that have good oral health. You're telling me nothing on day 20 that I need to do." That's why we've also included maximizing magnesium. Magnesium is a fascinating mineral. Are you aware that if you up your magnesium intake, you will likely improve your blood fluidity? Let me just share from our chapter. This is chapter 34 that goes along with day 20. And when I wrote about magnesium and did the research on it, it's really pretty amazing. In the research, if you up your intake of magnesium, get your magnesium levels higher, you decrease insulin resistance. Some of the research, in fact, actually shows if you want to avoid diabetes altogether, one of the things you can do is keep your magnesium status more optimal. So magnesium's a winner in the insulin resistance department, and think about it, that's one of those things that if it's bad, if your insulin resistance is bad, if it's high, it's going to worsen your blood fluidity. If you supplement with magnesium or eat more magnesium-rich foods, you're going to decrease inflammation in the body, lower oxidative stress. Interesting, as you look at all this, direct measurements of what happens when magnesium levels are optimized. You will decrease levels of von Willebrand factor. Remember, one of those factors that worsens your blood fluidity, and your platelets will also be less likely to clump together. Magnesium, clearly a winner. So how do you optimize it? what kind of foods are rich in magnesium? Well, among the foods that are rich in magnesium are beans and seeds. Green leafy vegetables are also on that list. But if I haven't motivated you already with this list, let me just throw in one other thing. Do you know that there's a connection between magnesium and hearing loss? That's right. In the research, better magnesium status is associated with decreased risk of hearing impairment. So here's my practical message. If you're already having problems with your hearing, you need to get really serious about the magnesium, even if you've already decided you've got to work on your teeth. Okay? So I'm not saying either or, depend on your dentist or maximize magnesium. I'm saying do both for your challenges for day 20. And here's the interesting thing. If you say, Dr. DeRose, I don't know how I could eat more green leafy vegetables. I don't know seeds, beans. I'm already maxing out on those. I don't know how I could do any more. Well, then consider taking a magnesium supplement. You can take a pill form. You could take it in liquid form. Magnesium is abundantly available in the health food store. Now, if you've got kidney problems, don't just start taking more magnesium, because that is one case where magnesium can actually be dangerous or life-threatening. So if you got kidney failure, don't go for more magnesium. Remember, any questions about any of these things we're talking about in this general educational journey, talk with your personal physician. One last message. If you're worried about getting too much magnesium, let me tell you what the most common side effect of getting too much is. It's your stools being too loose. Now, some people say, Dr. DeRose, that's great news because I'm dealing with constipation. But if you're not constipated and you're starting to supplement with magnesium, if your stools get too loose, just back off a little bit. Take less magnesium, and hopefully you can get the best of both worlds. Looking to maximize your Methuselah Factor, then maximize magnesium. Make friends with your dentist. Depend on him or her to help you keep in the best of oral health. Those are the messages for day 20 on your journey to better blood fluidity. I'm Dr. David DeRose.